everybody. Today we are talking about fireworks safety. It is July 3rd. Obviously tomorrow is Independence Day and a lot of people will be celebrating with fireworks. It's just part of the 4th of July. And the place that you do not want to end up is here in the Trauma Bay at Nebraska Medicine. I'm joined today by Dr. Zachary Bauman. Thank you for being here.
Thank you for having me.
You bet. And we're going to just talk a little bit about the things that people need to keep in mind as they celebrate the 4th of July. What advice do you have anybody who wants to shoot off fireworks at home this year?
I would say, that fireworks, although fun, can be dangerous. And, we see a lot of injuries every year on the fireworks season, anywhere ranging from just minor burns to actually we do see people that occasionally suffer mortality and die from fireworks. And so it's important to be safe, make sure that you're shooting them off in a safe and well-grounded area, that you're not shooting them into big crowds with a lot of people that could potentially get injured from some of the shrapnel that comes with fireworks. So
I think for a lot of families, part of the tradition is finding fireworks, maybe letting your kids start to light off a few, and there's things people think of as being more kid-friendly, things like sparklers or snakes or smoke bombs. Is there such thing as a safe firework?
Well, I don't really think that fireworks are necessarily classified as safe. There might be some more quote-unquote kid-friendly fireworks. However, there's still risks that come with those. You do have to use a lighter to light those fireworks. And so there is the heat that comes with them. Sparklers, they can get up to 3,000 degrees Fahrenheit. When you're using those, and so those can easily start something else on fire, or that the kid themselves, or cause a severe burn. So you want to take just a lot of precaution, a lot of supervision when working with kids and them lighting off fireworks.
Supervision is important. Obviously knowing what's going on, knowing what the situation is like around you. And that even comes into play if you're at a fireworks show and somebody else is lighting off, because bystanders can get injured.
Absolutely. I've seen on numerous occasions where a firework fell over, and shot it into the crowd, or, the firework just didn't shoot off appropriately, so maybe it didn't go high enough and exploded maybe too soon. And so, you have to be very careful about that. I would definitely make sure that you're a distance away from the fireworks being shot off. And you're always kind of paying attention, making sure that your fireworks are bought at a well-represented store, and that you're not home making your own fireworks. I think that a lot of people get into trouble when they try to maybe modify the fireworks that they have, and then that's where they have the problems.
That's when it can lead to some bad decisions. And speaking of bad decisions, something you see frequently here when you're treating fireworks injuries are people that are basically mixing alcohol and fireworks.
Absolutely.
So how do those two things go together?
Well, obviously they don't go together very well. I would say that the majority of our patients that we see around the 4th of July that have firework injuries are usually have been ingesting alcohol in some form. And so, you just usually make not as good of decisions when you're intoxicated. And so it's important that if you're going to be using fireworks, I would highly recommend that you remain sober and don't involve alcohol in those events.
So a lot of the people that will get injured by fireworks aren't necessarily going to wind up here in the emergency room. How do people know, what they can treat at home, and what's the best treatment if they do have minor burns?
Sure, I would say, minor burns can just be treated very similar to like a sunburn. You get a sunburn, you put maybe some aloe on it or bacitracin and just wash it really well and just keep it covered. If they're more severe burns, definitely want to come to the hospital for a treatment, and then obviously if there's more severe injuries, you want to make sure you come to the emergency department as well.
So we don't want to see you here in the emergency department at Nebraska Medicine, and there are several other cases where people will be out and about doing recreational activities. Any other advice for people who are going to be boating over the long weekend, riding ATVs, any of those types of activities?
Absolutely. I would say that, once again, alcohol just probably doesn't go well with these other events. So you want to make sure that if you're using a boat or an ATV, that you remain sober and capable of driving that vehicle, or riding on those inner tubes or whatever they may be. Also keep an eye out for your surroundings, because other people may be out there and may be participating in the festivities and drinking and stuff, and so they may not be aware of you, and so it's also important that you kind of keep a close eye out for them. Right,
it's always important to drive defensively as well and to take good care of yourself. Any other warnings you would like to give people, because you'd like it to be I shouldn't say the Q word, that's a bad word around here, but to make things easier for you and your colleagues in the trauma department, because you would rather it be a nice, quiet holiday weekend, right?
I think that we've covered a lot of it. I'd say, just make sure you're wearing your sunscreen. That's always a big push, especially during this time of year when people are outside, in the water, and they're not, applying their sunscreen, can get bad skin cancer and stuff, and we just don't want that either, especially in the young individuals. So,
all right, Dr. Bauman, thank you so much for your time today. So be happy, be safe out there. please don't wind up here. And if you have any questions, go ahead and post them below in the comment section, and we will get to those as soon as we can and get your response. Make sure to join us next week for the next Moments in Medicine Live.